Next guest here is Dr. Ahmed, cardiologist over at Advantage Care Physicians. Thank you so much for being with us.
Thanks for having me, Jessica.
So we just saw one scene, but we've seen it day in and day out. We see, thousands of people gathering. This is obviously a very pivotal moment in time in New York City, across the country. People feel the need to be out there. There's changes that have to be made. We need to make a change and once and for all. So a lot of emotions, and you want to be with other people. You want to demonstrate. You want to be out there. But what are the concerns? Because we are not done with this pandemic. We still know there are new cases each and every day, especially in certain neighborhoods here in New York City. So kind of what are your concerns as to the protests that have been going on?
Yeah, absolutely. As you alluded to, we're facing two crises right now, a social justice crisis and a public health crisis. We shouldn't have to choose between our request for constructive, positive change and our desire to protest. We shouldn't have to choose between that and our desire to protect our families, our communities, and our health. So that's why the governor said protest with a mask. I will leave all the policy and political discussions to my other colleagues. From a medical standpoint, there are two sides of the coin that we have to be concerned with. One is exposure, and two is transmission. So exposure, if you will be protesting, what can you do to limit your exposure? One, wear a mask. That is still the state mandate and the recommendation from the governor's office. Two, maybe think about bringing a few masks with you. There may be other people there who aren't wearing them, and you may be able to reduce transmission that way. Three, be very important to continue testing, which we have helped with the city to expand all throughout New York City. So anyone should be able to get testing from this point forward.
Thank you so much.